Let us know why it's so important that the Department of Education act immediately, even though in technical terms you could say the risk is not immediate. The first speaker I'm going to introduce is Dr. David Carpenter, who joins us from Albany, where he is the director of the Center for Health and the Environment at the SUNY Albany Medical School. He's published about as much work on environmental exposure to PCBs as any scholar around. Please join me in thanking him for making the trip and welcoming him, Dr. Carpenter.
Thanks, Miranda, and thanks for the opportunity to tell you a bit about the health effects of PCBs. And that's my task. I think others will talk about the levels and that kind of thing. It is absolutely true that if you're exposed to PCBs, you don't get sick immediately. Let me give you an example that's particularly relevant to schools of one of the first episodes that led us to understand what PCBs do. This was what happened in Taiwan when PCBs got mixed into the cooking oil that people were using in their homes. The adults that were eating this contaminated cooking oil didn't show any ill effects for a period of about a year. But the children that were born to the mothers that took in these PCBs, they were less bright. It wasn't that they were all retarded, but their IQ was not as great as children that were not exposed. Now, in that case, the exposure was from eating PCBs, and you will see many of the agencies, both federal and state, that only talk about eating PCBs as being dangerous. And I don't mean to say that eating PCBs is not dangerous, it is. So if a kid in school goes and eats a little bit of the caulk that contains the PCBs, they will be exposed, and that is dangerous. But what is really of concern is that those PCBs don't stay in the caulk. They slowly evaporate, and they're in the air. And if a child is in a school that has PCB containing caulk, they're going to be breathing in PCBs every hour of the day that they're in the school. There have been many studies from different groups, including my own group, that have demonstrated that children exposed to PCBs, whether by breathing them in or eating them, their IQ is reduced, their ability to learn is reduced, and if there's something you do not want in a school, it's having a child exposed to a chemical that reduces their ability to learn. Schools are for kids to learn. Right. And in my judgment, the most dangerous effect of any chemical compound is to reduce the ability to learn and remember. Now, these studies from Taiwan also demonstrated that this was a permanent effect. They studied kids, the same kids, when they were 4, when they were 5, when they were 6, and they were 7, and there was no recovery of their ability to learn. There were some pretty bright kids in that group, but they were never as bright as the kids that were not exposed. And again, this is such an important issue when it comes to schools, because children that are breathing in PCBs all the time will be at a disadvantage in terms of their ability to learn. Now, PCBs have a lot of other health effects also. And again, they're not immediate ones. The ones that I'm particularly concerned about for kids in school is that these substances suppress your immune system. Now, if your immune system is not working right, you get sick more often. And when you get sick, it lasts longer, it's more difficult to recover from. And that's a problem. When your child gets a bad cold, most parents don't think maybe it was the PCBs in the school that caused the reduction in the immune system. So that's an issue that directly affects children in schools. Now, there are a variety of other diseases that have been related to exposure to these chemicals. PCBs cause cancer. Everybody knows cancer takes a long time to develop after you're exposed. So the kids are not likely to develop cancer while they're in school. But these compounds are stored in our bodies. Our bodies have great difficulty destroying them, breaking them down. And they stay in our bodies for many years. And so while the child may not get cancer or heart disease or diabetes or high blood pressure, all diseases that we know are at increased risk if you're exposed to PCBs. They may not get them while they're in school, but they may get them later in life. So I think I'll stop there, because my task was really to say what are the health effects of concern. For children in schools, number one is that these compounds reduce your ability to learn. Now, in fact, it's not just children. That's been demonstrated also in adults. I have a major research project with a Native American group in northern New York State. And we've demonstrated that the children, their performance on IQ tests is reduced in direct relationship to their exposure to PCBs. And then also, even in the adults, their ability to learn new things is reduced if they have exposure to PCBs. Schools are a place for learning, and we should not tolerate having children breathing in these compounds every hour that they're in the school. There is certainly also an issue with the contamination of the soil and the cough, because it's possible that kids will put something in their mouth that will get them exposure that way. But the major route of exposure, which the City Health Department has really not dealt with, the major concern is breathing these substances in. Let me stop there.